So welcome to Angel Health Academy. Topic for the day is job description of head nurse. Job description of head nurse or role and responsibility of various responsibilities of head nurse in the ward or nurses unit or nursing unit. Head nurse is also called as or otherwise known as ward in charge. She is the in charge of the particular ward or the unit. She is also known as senior nurse, or she is also called as first level nursing care supervisor. The ratio of head nurse to patient or bed is, as per the Indian Nursing Council norms, there would be one head nurse or ward sister that is required for 25 to 30 patients or 25 to 30 beds, or one head nurse for one particular ward or unit. That means in short, 1:25 to 30. That is one head nurse for 25 to 30 patients, or one head nurse or ward in charge per ward or per unit. This is a norms for recruiting a head nurse to a particular ward. So as we have already mentioned, the head nurse or senior staff nurse is also considered as first level nursing care supervisor in the ward. Thus, who is completely accountable for rendering the quality nursing care services to all the patients in the ward. So, she is accountable for nursing care management of the ward or the unit where she assigned. Then, she is directly responsible to the nursing superintendent grade 2 if there is a grade 2 nursing superintendent, or she is directly responsible to the nursing superintendent grade 1 for her ward management. So, nursing superintendent grade 2 will be the immediate supervisor of the head nurse. Then in addition to that, she takes the full charge of the particular ward where she assigned, and moreover she delegates the responsibility or assign the work, patient assignment for various categories of nursing and non-nursing personnel or workers or staff is working under her in that particular department or particular ward or particular unit. Then moreover, she is responsible for safety and comfort of all the patients in her ward. She is ultimately responsible for safety and comfort of all the patients in the ward. Now let us discuss about the job description or various duties and responsibilities of the head nurse or ward in charge. I have made two mnemonic. One is head nurse or ward in charge. My first mnemonic regarding the duties and responsibilities of a head nurse or a job description of head nurse is head nurse, that is a capital letter, or ward in charge. Then second mnemonic is DASE, D-A-S-E. In this video, I would like to talk about head nurse or ward in charge as the mnemonic for the job description or duties and responsibilities of the head nurse. After discussion, you can apply the same content with the mnemonic, second mnemonic, that is DASE, D-A-S-E. So let us talk about the job description with the first mnemonic, that is head nurse or ward in charge. So H stands for healthcare needs of all patients in the ward. So total healthcare needs of all the patient is the responsibility of the head nurse. So that is the H stands for healthcare needs. So direct patient care or therapeutic patient care, that is total healthcare in the ward. Second, E stands for educational role. E stands for educational role. It includes the staff development programs, orientation programs, in-service education program. All will be planned and organized by under the responsibility and accountability of the head nurse or ward in charge in the ward. Then moreover, arranging or making a conducive environment for the student teaching and learning activities. All comes under educational role. Then A stands for administration of ward or ward supervision. That will discuss later under ward management. Okay. That is administration of the ward and total administration of the ward activities and moreover ward supervision. Then last D stands for direct patient care. Either she make all the that subordinates or the staff to render the quality patient care, and in some situation she herself provide direct patient care if it is required. That is what we have discussed here, healthcare needs of all the patients admitted in the particular ward or department or unit. That is about the expansion of head, H-E-A-D. Then N stands for nursing care as per the policy, that is nursing care plan or nursing care process to render the quality patient care as per the policy. So she has to plan all the nursing care process or nursing care management in the ward which is rendered by the different assigned staff. Then U stands for universal precautions, so taking universal precautions in the ward to protect and safeguard her patients. That is safety, comfort and hygiene of the total patients in the ward is the responsibility of the head nurse, or she is accountable and responsible for the safety, comfort and hygiene of all the patients in the unit or in the ward. That is universal precaution. U stands for universal precautions. Then R stands for rounds. She has to take the rounds and she has to make the rounds. Taking rounds from the doctors, different doctors, that is general round and special round. Then takes rounds along with the nursing superintendent. Then takes round with the nursing care officers. If there is a nursing care officers in the hospital, she has to go along with the nursing care officers round. Then she also makes the round along with the nursing staff in her department and along with the students who have present in that particular ward or the unit. So making the rounds, every day she has to make the rounds in the early morning along with the nursing staffs of that particular unit or ward and along with the students who are assigned in that particular ward. Then S stands for supervision. Supervision of all the staff, supervision of the students and supervision of the other professional and non-professional staff, those who are present in the particular ward or those who are working under that particular ward. So supervision of the staff, students and others, that is the responsibility of the head nurse. Then E stands for equipment and supplies. So she has to manage all the equipment articles available in the ward to render the quality nursing services and all the supplies needed for quality patient care. So management, procurement, repair and maintenance of periodical repair and maintenance of all the equipment and supplies are the job description or duties and responsibilities of the head nurse in the ward. So that is the expansion for nurse, N-U-R-S-E. So now we got the expansion, total expansion of our job description of the head nurse. The next area of the mnemonic we are going to talk about ward in charge. So W stands for ward management. So it is the most important or significant role and job description of the head nurse is our ward in charge is management of the ward. So maintaining the ward statistics, everyday statistics and sending the report to the nursing superintendent or nursing superintendent grade 2. So every day she has to prepare the ward statistics. So she has to maintain the census report, etc. Then periodically conducting the ward conference or ward meeting to improve the quality of the patient care. Then ward teaching, clinical teaching, formal and informal clinical teaching such as bedside clinic, nursing rounds, demonstrations, etc. To conduct the ward teaching in the particular ward is the responsibility of the head nurse under ward management. Ward management also consists of the other all these activities such as A stands for admission and discharge of the particular ward, admission procedure and discharge procedure. Then maintaining all the records that is present as per the policy in the particular ward is the direct responsibility of the head nurse or ward in charge. Maintaining and storing all the documents as it is a legal document, she is accountable to maintain the records. That is R stands for records. Then D stands for discipline in the ward, maintaining the disciplines among the different professional and non-professional staff in the ward. So maintaining disciplines and solving the conflict among or between the staff in the ward. So maintaining the disciplines, control the all the staff in the ward. Then D also stands for diet plan, making diet plan for the patients, writing diet sheet. It also includes like daily planning, preparing duty roster, etc. The next I stands for inventory control, that is material management, inventory control, periodical or regular inventory control. Then indent, making procurement of the article through indent, filling the indent form regularly and getting the articles. Then in service education, we already said in service education under educational role. So arranging the orientation program for the new staff, for the students, and conducting and monitoring the staff development programs, staff welfare programs, or periodically giving special education program for the staff as in-service education. So periodical conduct and make the staff to participate in the various in-service education program, etc. all comes under I. Then N stands for nursing standards, maintaining the nursing standards and the quality of the nursing care. Nursing standards includes quality assurance. So that can be done through the policy manual, participating in making the policy to render the nursing services, protocol to render the various nursing procedures in the ward, all comes under nursing standards. So that is about the expansion of ward and in. All these activities or job descriptions are the part of the ward management only. Now the last part is about the mnemonic, that is CHART, C-H-A-R-T. C stands for clinical teaching, arranging various clinical teaching practice, clinical teaching methods for the staff and students in the clinics. Like as we are already mentioned, the ward teaching, ward conference, etc. So clinical teaching, it includes, as I already mentioned, bedside clinic, nursing rounds, demonstration, different ward conference, etc. Then not only teaching but also guiding, training and supervision of the staff and students in a clinical teaching. Then H stands for help. H stands for help the staff or students or assist the staff and students. Either we already mentioned, that is to render the direct patient care, that is quality health care management for all the patients in the ward. So head nurse has to help all the staff in the ward, or she assists them to render the direct patient care, and moreover she assists the patient and relatives to follow the rules and regulations and policy of the hospital during the period of stay in the hospital as they got admitted their loved one. So assist the patient and the relatives in following the hospital routines, policies, etc. Make them to understand that hospital policies. And she also helps in conducting and participating various medical and nursing research in the hospital. So involving, participating and helping the people to conduct medical and nursing research in the ward. Then A stands for assignments. So the most important ward management responsibility, as I said, the daily making patient assignment. Patient assignments includes like a team method, then case method, primary nursing method, or even modular method, etc. So practicing different methods according to the situation and according to circumstances in the ward, thus to improve the quality of the health care to the total patients in the ward. Then R stands for reports, maintaining various reports in the ward. For example, confidential report of the staff person. So periodically or annually she has to send the confidential report to the concerned authority. Then medical legal case report she has to inform to the concerned authority, that is MLC report. Then making various incidental report, incidents which occurs in the ward. It all comes under reports. So maintaining all the reports in the ward is the responsibility of the head nurse. Then G stands for guidance and supervisions. We already mentioned about the supervision. Now not only supervision but also she has to guide all the staff and students to render the comprehensive, quality assured nursing care to all the patients in the ward. That is guidance and supervision of all the staffs and students to render the comprehensive and quality nursing care to the patients. The last E stands for evaluation. Evaluation of the nursing care in the ward or evaluation of the patient care, that is nursing audit. That is periodical evaluation of the nursing services and modification of the nursing services if required after doing various nursing audit or evaluation. Then evaluation of the performance of the staff through performance appraisal form. Evaluation of the periodical evaluation of the staff nurses in the ward. Then student evaluation. So evaluation of the students is also a responsibility of the head nurse in the ward. So these all are the responsibility of the head nurse or job description of the head nurse under the first mnemonic. The second mnemonic is, that is days. So all this job description you can again classify it into D stands for direct patient care, A stands for administration, S stands for supervision, and E stands for education. So all these activities you can even categorize under these four headings, that is direct patient care, administration of the ward, that is ward management, supervision of the staff and students, and doing staff development program, orientation program, all under education. So thanks for watching. Hope this video really benefits in your studies and exams. Please subscribe and share, comment and like my channel, and thank you so much. Until we meet the next video.